Hey there, my name is Major Mark, and I want to welcome you to this endodontic interview video. Interviewing the patient to find out what their symptoms are is probably one of the most critical parts of the endodontic exam. My experience as a young dentist was I would zoom in on the tooth that they were complaining about, ask them a few questions: does it hurt now, has it hurt before, and off I went. And I learned quickly that, and especially once I was taught how to properly do an endodontic exam and questionnaire, that a lot of the answers reside in the questions that I answered, or the questions that I asked the patient. So this is Major Meadows asking our patient some questions about her symptoms, and let's get started.
Good morning, how are you?
Good morning, not too bad.
Okay, so what brings you in this morning?
So I have a tooth up here that was in pain. I was hot and cold sensitive about a couple weeks ago,
Okay.
and now it's kind of a dull pain, but it's still there.
Okay. Are you on any medications right now?
No.
No. Do you have any allergies to any medications?
No.
No. So how long has the pain been there, like starting way back?
So it was a couple weeks ago. It was really painful. I would say maybe about a 9 out of 10.
Okay.
And then I took some Tylenol. Kind of, it went away, but when I bite down now, I still feel it.
Okay. Can you tell exactly which tooth it's coming from, or is it a general area?
Just in my upper right side.
Okay. Right now, do you find the heat and the cold bother it?
Not so much anymore. It's just when I bite down, I can feel
Just when you're biting?
pressure.
And when you're just sitting there today, are you having any pain?
No, only if I bite down.
Have you noticed a bad taste in your mouth at all?
No.
No. And did you notice? Have you looked in your mouth and have you noticed like a little, what I would call like a pimple on the inside of your gums?
No.
No. And has it been waking you up at night now?
It did initially.
Okay.
When I would lie down, I would feel throbbing, and now not anymore.
And you've already said it hurts to bite. I'm just going through my checklist, so I have a detailed checklist that I'm using,
Okay.
just so I make sure I ask all the pertinent questions. And how would you describe the pain? Is it a sharp or is it dull?
Yeah, it started off as a sharp pain, throbbing, and now it's dull and only when I bite.
Okay. And today, on a scale of 1 to 10, where the pain would be 5 that would interrupt your day, how much pain would you be in?
I would say a 1 or 2.
And then when you bite on it, does it go higher?
Yes.
And is the pain, do you feel like it's just in that one area, or are you finding it's spreading?
It's in that general area.
Okay. Does it hurt more at night?
It did at first, and now, no.
At this point in time, does anything relieve the pain?
No.
No. And if you've noticed when you lay down, does the pain actually get worse, or is it just the same?
Not anymore. It did a couple weeks ago when it was really painful.
And do you have a history of clenching your teeth or grinding your teeth?
No.
No? Okay. So what I'd like to do now is just have a good look on the outside of your face, and then I'm going to look on the inside of your mouth just to see if I can see anything going on. Okay?
Sure.